Welcome back to TV5 News at 9. New technology is helping provide people with breast cancer care and prevention. Calling in this morning to tell us more, we have breast surgical oncologist Dr. Ashley Richardson from the Karmanos Cancer Institute. Dr. Richardson, thanks for joining us this morning. How are you?
I am great. Thanks for having me.
Of course. So start us off by telling us, how is technology being used by Karmanos to individualize women's cancer care?
So we have now implemented a new program called Volpara Risk Pathways, where we are integrating patients' breast health, their breast density, their family history, prior biopsy results to assess risk factors. We know that early detection is key to identifying breast cancer and also helping prevent a future breast cancer. So we've been very proactive about implementing new technology to try and identify those ladies that are at high risk. And then once we identify them based off their mammogram or ultrasound or breast MRI, then we're able to act quicker to identify a future problem.
Very good. Yeah. Can you tell us what role patients play in their own risk assessment?
So how the risk assessment works is when a patient signs up or is scheduled for a mammogram or breast ultrasound, they'll be emailed or text messaged a risk assessment, and then they can go online and fill out all their assessment to the best of their ability and answer questions related to family history, their breast density, because we know that there's a lot of information about breast density out there, and patients want to be proactive about their health, and they can fill out this calculator and it'll give a risk assessment to identify those that are high risk. And then after their imaging, they will take into account the imaging results and the calculator to identify those that may need additional workup or to see the breast specialist.
Yeah, awesome. And where is this technology really being used?
So it was initially implemented down in Detroit through Karmanos, and now we have it at multiple Karmanos locations, Detroit, Farmington Hills, and most recently Fenton and Flint, and we also have it in Clarkston. So, throughout mid-Michigan, multiple options for the Volpara risk assessment through Karmanos.
And I'll always applaud, technology or implementations to always help early detection. So what does this tool mean to you as a specialist in breast health?
Well, early detection is key, and we want to be proactive. And if we can identify those ladies that are high risk early, then oftentimes we can do things sooner, or we can screen them more frequently. So somebody that's identified as high risk will often be seen in the breast office, in the breast clinic, and then we can talk about imaging modalities that may assess their risk and keep a close eye on them. Oftentimes that includes offering genetic testing, which we can do right here in the office to see if there's a genetic mutation that increases their risk. We also talk about high-risk imaging. So oftentimes it's not just a mammogram, but we can implement a breast MRI or breast ultrasound and then follow them closer. Patients now know that early detection leads to better survival and better outcomes. So if we can find something small and early, then usually it leads to less treatment and a better survival.
Yeah, awesome. And how can someone learn more about this?
So we have a website that's very easy to access, mclaren.org/Flint Fenton 3D Mam. So it's kind of a mouthful, but mclaren.org/Flint Fenton 3D Mam. Certainly going on to Karmanos' website as well, but accessing that website will get them to more information regarding the Volpara risk assessment.
Dr. Richardson, anything that you want to ask, maybe you didn't get the chance to say yet?
No, I just appreciate you guys taking the time to promote this new program. We are very excited to bring it, especially to the Flint and Fenton area. We have a lot of resources in regards to breast health and breast surgery and breast oncology, and certainly allowing patients to be more proactive about their health leads to better outcomes for our community, and that's really what we care the most about.
We appreciate your time this morning, Dr. Richardson. Thank you.
Of course. Thank you so much.
Of course. And for you at home, you can find more information on this topic by going to our hot link section on our website at WNEM.com.